There they are, again, for everyone if you have not refreshed your mind on the 10 essential services. But you'll notice at the top that it says FAB has 12 domains. So that is just a little confusing. When we went through the 10 essential services, which we're now calling domains, we found a few gaps, and we added 2 to the 10 essential services. So you will see domain 11 reflects the management and administration of the health department, and domain 12 relates to governance. So the other 10 are in order like they have been for years, plus management, administration, and governance. There they are, if anyone wants to see those 12 domains. But truly, the structure and framework for the domains and the standards and the measures uses this taxonomy that you can see here. The domains are made up of standards. The standards are made up of measures. The measures have required documentation and guidance for the selection of those documents that you need to submit. So they're all set up in this consistent way. There's also what we've added to these domain standards, measures, and documentation is a purpose statement in each measure, as well as a significance statement and a guidance section, trying to make it easy and trying to make it consistent so everyone knows what the expectation truly is. So if we look at this, which you'll see here is very small again, this is domain 9 of our 10 essential services. Domain 9, as you know, says educate and continuously improve health department processes, programs, and interventions. Under that domain are 2 standards, 9.1 and 9.2. 9.1 says use a performance management system to monitor achievement in the organizational objectives. That's what we're measuring. And number 9.2 is develop and implement QI processes integrated into organizational practices, programs, processes, and interventions. If you look, I pulled out 9.2 to look at just a drill down again on this taxonomy. You have the standard, you've got a measure, a purpose, and a significance. Under that, you have a required documentation, and guidance for how that documentation might look. So again, we've outlined each of the standards and measures in this same format for consistency, for ease, and to make sure that everyone understands what the expectation is in the required document. So the required document for the quality improvement process is that someone needs to show a written QI plan. Does your health department have a written QI plan that's signed off, approved, implemented in your health district? Standard 10, and I'm focusing on this one just as another side note. Standard 10 talks about identifying and using best available evidence for making informed public health practice decisions. 10.1.2 is foster innovation in practice and research. Exactly what we're here to talk about these last couple days. Research fits into the 10 essential or the 12 domains of FAB critically, as QI does too, weaving through each of the other domains. 10.2 is promote understanding and the use of a current body of research, results, evaluations, and evidence-based practices with appropriate audiences. Again, you are all doing a great job helping us obtain this standard. So as I close, so that we can take a few questions if necessary, I wanted to share this with you. My dad turned 89 years old yesterday. And in his spare time, because he still works, he builds clocks. So this is one of the newest clocks I have in my home, and I have several, as you might guess. But my dad's, one of his favorite sayings is that timing is everything. As a clock builder, he of course would say that. And for me, the time is now. There is no better time for public health to align with public health accreditation. And there is no better time to prove the health department's credibility to the public through the accreditation process. The time is now to transform public health and the way we do our work at the state, local, tribal, and territorial level. The time is now to look at the opportunities that public health accreditation brings to the research world And those opportunities are rich and endless. So as I close, I just wanted to thank each of you for the work you are doing personally in helping public health move forward on this really exciting journey. Thank you.